Committee on Health, Education, Labor, and Pensions will please come to order. I thank our witnesses for being here. This hearing is a direct response to President Trump's call for radical transparency in how we conduct governmental affairs. And I thank Secretary Robert Kennedy for echoing that call for radical transparency in his testimony before the Senate Finance Committee. Now, I approach this hearing as both a doctor and as a senator. And as both, I should be, but frankly, I think we all should be, first and foremost, friends and allies of the American people. They are looking to us to figure out how our government works best for them. And if we look at any other agenda, we are not doing our duty to the American people. Now, that was the attitude I brought advocating for my patients. I think that is the attitude we should bring as senators towards this issue as well. And if our loyalty lies elsewhere, then we fail as senators. As a doctor who treated children and families for over 25 years, I have the absolute obligation to do the best I can for the health of those whom I am entrusted to serve. In this case, I am, but we all are, entrusted to serve the moms and dads, their children, their parents, so that when I or any doctor makes a recommendation to provide a life-saving vaccine or treatment, they can reliably rely upon CD guidance. If doctors do not have clear guidance or have a reason to distrust what's coming out of the CDC, they cannot make informed decisions to protect their patients. Children, and I would say adults' health is at risk. Now, as a senator, and this speaks directly to all of us at this table, I am focused on the fact that Dr. Monarez was the first CDC director requiring Senate confirmation. We Republicans supported making the CDC director Senate confirmed. It's such an important position that we demanded a role in her or his choosing. And so part of our responsibility today is to ask ourselves, if someone is fired 29 days after every Republican votes for her, the Senate confirms her, the secretary said in her swearing in that she has, quote, unimpeachable scientific credentials, and the president called her an incredible mother and dedicated public servant, like, what happened? Did we fail? Was there something we should have done differently? The secretary in his Senate Finance testimony justified Dr. Monarez's firing by stating, quote, it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest, end quote. If what he said is true, we as senators need to ask ourselves, did we look past something? Did we do something wrong? It may be that we did nothing wrong, in which case, Dr. Monarez and Dr. Ari, the onus is upon you to prove that the criticisms leveled by the secretary are not true. Now, ultimately, we all have an obligation to truth. It may be impossible to learn who's telling the truth, but this hearing is an initial step in trying to answer why the top leadership of the CDC was fired or resigned before they could be fired. Turmoil at the top of the nation's top public health agency is not good for the health of the American people. Now, I've long believed the CDC needs reform to regain the trust of the American people, and earlier this year launched a working group of Senate Republicans on the topic, including Senators Paul, Murkowski, Marshall, and Scott from this committee, which has met numerous times on a staff level. And fortunately, we have a president who has called for radical transparency in government. President Trump clearly wants to make America healthy again. I thank him for that. The American people need all the facts, not a version of the facts that fits a certain narrative or agenda. And it's with this mandate from President Trump that the HELP Committee is conducting this oversight. Today, we'll hear from Dr. Monarez and Dr. Ari, who have raised serious allegations that strike at the core of the CDC's credibility. The allegations need to be scrutinized and examined through an impartial lens. I'm also inviting HHS officials at a later point, including Secretary Kennedy, to speak with the committee and refute anything which is said today. This is how we achieve President Trump's goal of radical transparency, giving Americans the full picture so they can judge for themselves. This is not about politics. This is about protecting children's health and rebuilding trust in institutions. I want President Trump to have the best CDC in our nation's history. I want to work with the president to fulfill his campaign promise to reform the CDC and make America healthy again. The president says radical transparency is the way to do that. This hearing is one step closer to delivering President Trump's mission.